bright surgical lights, a dying arm, and a decision that would expose a ghost who had been hiding for 23 years. Surgeons mocked the rookie nurse standing silently in the corner of Operating Room 3. She was nobody, just another float pool worker they barely noticed. But when a wounded Marine colonel opened his eyes and raised his hand in a trembling military salute calling her major, everything stopped. Because that rookie nurse was not who her badge claimed. She was a combat surgeon who had been declared dead in 1992. A woman who made an impossible choice in the desert that saved 5 lives but destroyed 2 others. A ghost who buried her skills to escape the weight of playing God under fire. This is not a story about heroes. This is a story about the unbearable cost of saving lives when you cannot save them all. About the math of suffering. About impossible choices that haunt you for decades. And about what happens when your past refuses to stay buried. Stay with this story to discover what really happened at Al Jura checkpoint and why sometimes the right decision can destroy you anyway. Before we begin, take 2 seconds to comment where you are watching from and hit subscribe. These stories exist because people choose to stay with them. That salute hung in the air like a grenade with the pin pulled. 12:44 p.m. was not supposed to be dramatic. The operating room hummed with the familiar sounds of a weekday afternoon. Ventilation whispering overhead. Monitors ticking their steady rhythms. Stainless steel instruments laid out with practiced precision. Outside, the glass sunlight cut through the hospital corridor bright and ordinary, the kind of light that made everything feel under control. But nothing was under control now. Dr. Robert Chen stood frozen at the surgical table, scalpel still in hand, staring at the rookie nurse he had barely acknowledged for the past 45 minutes. Kate Hayes. Float pool. Transferred from Kaiser Portland 2 months ago, according to her personnel file. Quiet. Competent enough, invisible in the way that new nurses often are when they have not yet proven themselves worthy of attention. Except Colonel James Reynolds was saluting her with the kind of respect soldiers reserve for commanding officers, and calling her major. Kate had not moved. She stood near the wall where she had been stationed since the case began, medication tray still in her hands, face drained of color like someone watching a coffin being exhumed. Her eyes were locked on Reynolds with an expression that was not surprise. It was recognition, and something deeper, something that looked like grief. Dr. Chen cleared his throat sharply. "Colonel, you are disoriented. We need to focus on your injury." Reynolds shook his head, once the motion precise despite the pain etched across his features. His good arm remained raised in that perfect salute. "I am not disoriented, doctor. I know exactly who I am looking at." The surgical resident, Dr. Amanda Torres, stood with a chart frozen halfway to her chest. A scrub tech near the instrument table had stopped mid-reach for a clamp. Even the anesthesiologist looked up from his monitors, attention pulled by the wrongness of this moment. Kate finally moved. 1 step forward. Just one. Her voice, when she spoke, was quiet, but carried an authority that made everyone in the room instinctively listen. "Sir," she said, addressing Reynolds directly, "you should not move. You are critically injured." Reynolds lowered his arms slowly, but his eyes never left her face. "Ma'am, I have been critically injured before. You saved my life then, too. Operation Desert Shield. Checkpoint Whiskey. August 1991. The words landed in the operating room like artillery rounds. Dr. Chen felt his grip tighten on the scalpel. Desert Shield. That was military. Combat operations. And this woman, who supposedly had 5 years of med-surg experience at civilian hospitals, was being connected to battlefield medicine by a wounded Marine colonel who looked at her like she had walked through fire for him. Kate took another step closer to the table. Her hands were steady on the medication tray, but Chen could see the tension in her shoulders, the way she held herself like someone preparing for impact. Colonel Reynolds, she said carefully. I think you have me confused with someone else. No, ma'am. Reynolds' voice was growing weaker, but his certainty was absolute. I never forget a face, especially not the face of the surgeon who performed a field amputation on my sergeant while we were taking mortar fire. You saved 19 men that day. I was number 17. Dr. Torres made a small sound. Surgeon. She looked at Kate with new eyes. You are a surgeon? Kate did not answer. She was staring at the monitor displaying Reynolds' compartment pressure readings. Her eyes moved across the numbers with the focus of someone reading a language that others could not speak. Then she did something that changed everything. She set down the medication tray and stepped fully into the light around the surgical table. When she spoke again, her voice had shifted. Still quiet. Still controlled, but carrying a precision that made Dr. Chen straighten unconsciously. Dr. Chen, she said, you are looking at a delayed compartment collapse pattern, not acute necrotic syndrome. Chen blinked. Excuse me. Kate moved closer to the monitor, her finger tracing the pressure curve without touching the screen. The spike at 68 millimeters of mercury does not match tissue necrosis timeline. If this were true, vascular severance, you would see ischemic changes in distal tissues within 90 minutes. You are at minute 127. The room went absolutely silent. Dr. Torres found her voice first. How do you know that Kate ignored the question? She was focused entirely on the data, now processing it with a speed that suggested she had done this calculation hundreds of times before. The radial pulse is weak because of vessel compression, not occlusion. The shrapnel pattern here, she indicated the X-ray displayed on the adjacent screen, created a mechanical lock in the fascial compartment. If you proceed with amputation, you will be taking a salvageable limb. Dr. Chen felt something cold slide down his spine. Those terms, fascial compartment, mechanical lock, delayed collapse pattern. He had heard them before years ago in a lecture given by a visiting military trauma specialist. They were not part of standard civilian orthopedic vocabulary. They came from battlefield medicine, from places where doctors operated in tents under fire and made decisions measured in seconds rather than consultations. He studied Kate Hayes with new attention. Really looked at her for the first time. She stood differently than he had noticed before. Not with the deference of a new nurse, but with the stillness of someone accustomed to command. Her hands, which he now saw clearly, bore faint scarring along both forearms. Old burns healed but permanent. Who taught you that terminology? Chen asked quietly. Ati met his eyes. No one taught me, doctor. I learned it in conditions where textbooks were not available, and mistakes were fatal. Colonel Reynolds coughed the sound wet and pained. Tell him, ma'am. Tell him who you really are. Kate was silent for 3 heartbeats. Then she turned to face Dr. Chen fully. My name is Catherine Margaret Hayes. I hold a medical degree from Stanford. I completed surgical residency at Walter Reed Army Medical Center. And from 1990 to 1992, I was attached to the 274th Forward Surgical Team supporting 1st Marine Division operations in Kuwait and Iraq. The resident gasped audibly. You were a combat surgeon, Dr. Torres whispered. Kate nodded once. I performed forward surgical operations under combat conditions. Triage, stabilization, emergency procedures to keep wounded personnel alive long enough for medevac to definitive care facilities. Dr. Chen processed this information with the careful precision he brought to diagnosis. It explained the terminology. It explained her reading of the pressure patterns. It explained why Colonel Reynolds was looking at her like she was simultaneously a ghost and a miracle. But it did not explain the most important thing. If you are a surgeon, Chen said slowly, why are you working as a float pool nurse? Kate's expression closed like a door slamming shut. Because I do not practice surgery anymore, Dr. Chen. I have not operated in 23 years. 23 years. The number hung there. Dr. Chen did the math quickly. 1992 to 2025. Kate Hayes would have been in her late 20s during Desert Storm. She would be in her early 50s now, though she looked younger. 23 years was enough time to bury a past, to build a completely new identity, to hide. But why would a skilled combat surgeon choose to hide? Colonel Reynolds answered the unspoken question. "Ma'am," he said, his voice fading. "They told us you died. Plane crash. 1992. We had a memorial service." Kate closed her eyes briefly. "I know. But you are here. You are alive." "Yes." The single word carried the weight of decades. Dr. Chen made a decision, not based on protocol or hierarchy or the careful risk calculations that usually governed his surgical practice. He made it based on instinct. On the way, Kate Hayes looked at those scans like she could see through them to the damaged tissue beneath. On the certainty in Colonel Reynolds's eyes. On the understanding that sometimes the rules exist to be broken when a life hangs in the balance. "Scrub in," he said. Kate's eyes snapped open. "What?" "You have 5 minutes," Chen continued. "If you can restore circulation to that arm, then we avoid amputation. If you cannot, we proceed as planned. But I am giving you the chance." Dr. Torres started. "We cannot just let an unlicensed—" "She is not unlicensed," Chen interrupted, still looking at Kate. "She has a medical degree, surgical training, combat experience. Her license may be inactive, but her knowledge is not." Kate stared at him. "You are risking your career on this." Chen smiled without humor. "You are risking more. So let us see if Colonel Reynolds' faith in you is justified." Kate moved to the scrub sink without another word. Dr. Chen watched her preparation with clinical interest. The way she soaped her hands, the angle of her elbows, the counting rhythm under her breath. Everything was precise, economical, the muscle memory of someone who had scrubbed in thousands of times. When she returned to the table, gloved and ready, the entire room seemed to shift. Kate positioned herself at the surgical field with quiet confidence. She adjusted the overhead light by just a few degrees, changing the angle of illumination in a way that suddenly made the swollen compartment more visible. "That positioning," Dr. Torres murmured. "I have never seen that approach." "It is not in civilian protocols," Kate replied. She selected a scalpel from the instrument tray with steady hands. "Dr. Chen, I am going to perform a longitudinal fasciotomy here." She indicated the precise location with the tip of the blade. "I will release the anterior compartment first. When I do, you will see dark blood. That is normal. Do not clamp until I tickle you. And if there is arterial bleeding," Chen challenged, "there will not be." The shrapnel missed the brachial artery by approximately 4 millimeters. "I can see the displacement pattern on the imaging." Chen wanted to ask how she could possibly see that level of detail in the scans. But Kate was already making her incision, and the time for questions was over. The blade moved through tissue with controlled precision. Dark blood welled up immediately, sluggish and pressurized, but not the bright arterial spray that would indicate catastrophic damage. Kate worked with practiced efficiency, her hands steady, her focus absolute. "Suction," she said calmly. Dr. Torres moved instantly, responding to the authority in Kate's voice without conscious thought. The monitor numbers began to change. 68 millimeters, 66, 64. The pressure was dropping as the trapped fluid escaped through Kate's carefully controlled release. "Second compartment," Kate announced. "Lateral approach." "Same depth." Dr. Torres said nervously. "This is aggressive." "It is necessary," Kate replied without looking up. "If you do not relieve all 4 compartments, the pressure redistributes and rebounds. You will lose ground." Chen watched the numbers. 62, 58, 54. Kate was right. The technique was working. He had seen compartment releases before, but never performed with this level of precision under such time pressure. Kate made the third incision, then the fourth, each one calculated to release pressure without causing additional trauma. The swelling visibly decreased as the compartments decompressed. "Pulse check," Kate said. Dr. Torres placed her fingers on Reynolds's wrist. Her eyes went wide. "I have a radial pulse. Faint, but it is there." The room exhaled collectively. Kate continued working, irrigating the wounds, ensuring proper drainage, monitoring the tissue response. By the time she stepped back and stripped off her gloves, Colonel Reynolds's fingers had shifted from gray-white to pink. "Circulation restored," Chen said quietly. He looked at Kate with something approaching awe. That was extraordinary. Kate did not respond to the compliment. She was staring at her own hands, at the scars that ran up her forearms, at the evidence of who she used to be written permanently on her skin. The moment of relief was shattered by a sound from outside. Distant at first, then growing louder, the rhythmic thump of helicopter rotors. Dr. Torres moved to the window. "There are helicopters landing on our helipad. Military helicopters." Colonel Reynolds smiled weakly despite his pain. "I filed a report 3 months ago," he said to Kate. "When I saw you working here, I told them you were alive. I did not think they would actually come." Kate's face went completely white. "Who did you tell everyone who would listen, ma'am? You have been listed as killed in action for 23 years. I thought you deserved to have your record corrected." The door to the OR burst open. The charge nurse, Patricia Green, stuck her head in, face pale. "Dr. Chen, there are Marines in the lobby. 8 of them. Full dress uniforms. They are asking for Major Catherine Hayes." Kate swayed slightly, catching herself on the edge of the surgical table. "They found me," she whispered. And behind the charge nurse, moving with the authority of someone who did not need permission to enter restricted areas, came a man in civilian clothes. Silver hair, ramrod posture, eyes that assessed the room in a single glance. He looked past Dr. Chen, past Dr. Torres, past the surgical team, and locked eyes with Kate. Then he did something that made everyone in the room freeze. He saluted. Slow, precise, perfect. "Major Catherine Hayes," he said. "My name is Brigadier General William Hargrove. We need to talk." Kate stood there in her surgical gown, still spotted with Colonel Reynolds' blood, staring at a past she thought she had buried in the desert, and a plane crash that was supposed to have killed her. Her hands, which had been perfectly steady during surgery, began to shake. Dr. Chen stepped forward instinctively. "General, this is a sterile operating environment. You cannot just—" General Hargrove held up a hand. "Doctor, I appreciate your concern, but this is now a federal matter. Major Hayes has information relevant to ongoing investigations, and she has been officially dead for 23 years. I think we can agree that Trump's hospital protocol—" Kate found her voice. "I am not a major anymore. I am a nurse, and I do not take orders from the military." The general's expression softened slightly. "Catherine, I am not here to give you orders. I am here because you are in danger, and because we need your help." From the surgical table, Colonel Reynolds spoke up, his voice weak but clear. "Ma'am, my training accident was not an accident. Someone sabotaged that grenade, and I think they did it to draw you out." Kate turned to stare at him. "What are you talking about?" General Hargrove opened a folder he was carrying. Inside were photographs, incident reports, names that Kate recognized from another lifetime. "Someone has been targeting the survivors of Aljura checkpoint," the general said quietly. 7 accidents in 3 years. All personnel who were present when you made your triage decisions. And we believe Marcus Webb is responsible." Kate grabbed the edge of the table for support. Marcus Webb. The name was a punch to the chest. The brilliant young corpsman who worked beside her in the desert, who followed her orders without question, who watched his best friend die because she decided there was not room on the evacuation vehicle. Webb was discharged in 1993, the general continued. PTSD, grief disorder. He disappeared from VA care in 2004, and ever since people connected to Al Jura have been having Mattel accidents. An alarm suddenly pierced the room, not the heart monitor, the pressure monitor on Reynolds' arm. The numbers were rising again. 60, 65, 70. That is impossible, Dr. Torres said. We just decompressed all the compartments. Kate moved back to the table, her training overriding her shock. She pulled back the fresh bandages and froze. There was a suture, neat, professional, in exactly the location that would reocclude the fascial release. This was not here before Kate said, her voice ice cold. Dr. Chen stared. Who could have accessed this patient? Kate looked up at General Hargrove. Someone who knows combat medicine. Someone who understands exactly what I did and how to undo it. She met the general's eyes. Webb is not just targeting survivors. He is already inside this hospital. And somewhere in the building, through corridors and stairwells and spaces where hospital security cameras did not quite reach Marcus, Webb was moving with the practiced efficiency of a man who had been planning this moment for 23 years, who had learned patience as a weapon, who had transformed his grief into methodical surgical revenge. The ghost had been found, and the man who blamed her for destroying his life was finally ready to make her pay. The hospital transformed in minutes. General Hargrove barked orders into his radio, and Marines materialized from the lobby like they had been waiting for exactly this signal. They moved with practiced efficiency, weapons holstered but ready, securing stairwells and elevators, with the controlled urgency of soldiers who understood that speed mattered but panic killed. Kate stood in the operating room, watching her carefully constructed anonymity disintegrate. 23 years of invisibility gone. The rookie nurse who kept her head down and her skills hidden was being stripped away, revealing the combat surgeon underneath. She felt exposed, vulnerable, like standing in the open desert, waiting for incoming fire. Dr. Chen was already working on Colonel Reynolds reopening the sabotaged suture, restoring the fasciotomy release. His hands were steady, but Kate could see the tension in his shoulders. He kept glancing at her like she was the equation he could not solve. Surgeon, nurse, ghost, soldier. Which version was real? All of them, Kate thought. And none of them. General Hargrove pulled Kate aside while his Marines secured the floor. We need to move you to a safe location immediately. Kate shook her head. If I leave, Webb will just disappear again. He has been patient for 23 years. He can wait another 23 if he needs to. So what do you suggest? Kate looked at the monitors, displaying Reynolds' stabilizing vitals. Use me as bait. Webb is close. He has to be. He sabotaged Reynolds within the last hour. That means he has access to this floor, to restricted areas, to medical supplies. He is either on staff or has credentials good enough to pass security. Hargrove studied her face. You are asking me to let a trained killer hunt you inside a civilian hospital. I am asking you to let me do what I was trained to do. Make hard calls under pressure. The general was quiet for a long moment. Then he nodded. Tell me what you need. Kate moved to the floor map posted outside the OR. 3 patients from Reynolds' training incident were admitted. Reynolds here in 412. Corporal Andrew Davis in 427. Private First Class Emma Torres in 431. All isolated, all vulnerable. Webb will target at least one more before he comes for me directly. How do you know? Because I know Marcus Webb. Kate's voice was flat. I trained him. He does not just want revenge. He wants me to feel what he felt at Al Jura. Helpless. Watching people die. Unable to save everyone. Hargrove leaned over the map. We have 12 Marines, 2 sniper teams on adjacent buildings. How do you want to deploy them? Kate traced the corridor layout with one finger. Marines on Reynolds and Davis, 2 each inside the rooms. No one enters without biometric verification. Not doctors, not nurses, not administration. No one. And Torres Kate met Dr. Chen's eyes. He had finished with Reynolds and was listening. I go to Torres. With Dr. Chen. Chen straightened. You think Webb will go after her first? Kate nodded. End of the hallway. Least visibility. And she is Dr. Torres's cousin. The surgical resident's cousin. Attacking her hurts our team cohesion, creates emotional chaos, divides our attention. That is horrifyingly tactical, Chen said quietly. That is how Webb thinks now. Kate's voice carried no judgment, just weary recognition. 23 years of PTSD and grief turned him into someone who weaponizes emotions the way we weaponize scalpels. General Hargrove was already deploying Marines, speaking rapid orders into his radio. Dr. Amanda Torres approached, face pale. My cousin is in danger. Yes, Kate said bluntly. She did not soften it. Torres was a surgical resident. She could handle hard truths. What do? We protect her, and we wait for Webb to make his move. The lights flickered once, twice. Then the emergency lighting kicked on, bathing the corridor in dim red glow. He cut the power, Hargrove said into his radio. Backup generators engaged, but he has control of the electrical system. A security guard's voice crackled through the radio. Sir, stairwells are locked from the inside. Electronic override. We are sealed in. Kate felt cold certainty settle in her chest. He trapped us. Webb planned this. He knew we would lock down the floor, so he made sure we could not leave, even if we wanted to. How long until we can breach the stairwells? Hargrove demanded. 15 minutes, maybe 20. The locks are hospital-grade security, built to contain quarantine situations. Webb has us exactly where he wants us, Kate said. Contained, isolated, playing his game on his timeline. Dr. Chen checked his watch. Then we move fast. Torres is in 4:31. Let us go. They moved through the darkened hallway, emergency lights casting long shadows. Kate's senses were hyper-alert, scanning for anything out of place. A door left ajar, a supply cart in the wrong position. The small details that indicated someone had passed through recently. Beside her, Dr. Chen moved with surprising calm for a civilian surgeon, suddenly thrust into what was essentially a combat situation. He is military, Kate reminded herself. Not active duty, but his father had been Navy. He understood chain of command, understood threat assessment. How do you stay so calm? Chen asked quietly as they walked. I am not calm, Kate replied. I am functional. There is a difference. They reached room 431. Kate paused outside listening. No alarms, no sounds of struggle. She pushed the door open carefully. Private Emma Torres lay in the bed, sleeping peacefully. IV dripping steadily. Monitors showing normal vitals. Bandaged leg elevated. Everything looked completely normal. Too normal. Kate moved to the IV bag, examined it closely. Standard saline. She checked the medication log. Nothing unusual. She inspected the bandages. No signs of tampering. He has not been here, Dr. Chen said. Kate shook her head slowly. No. He has been here. I can feel it. But he did not do anything. What? This is misdirection. Kate turned in a slow circle, scanning the room. He wanted us to come here, to focus on Torres, to worry about her. While her radio crackled to life. General Hargrove's voice, urgent. Major, we have movement on security cameras. Someone in scrubs heading toward the medication supply room. Near 427. Davis. Kate breathed. She was already moving, sprinting back into the hallway. Chen followed. They heard the gunshot before they reached the room. Muffled but unmistakable. Then shouting, the sound of something heavy hitting the floor. Kate rounded the corner to chaos. The door to room 427 hung open, kicked in from the inside. One Marine was down, clutching his shoulder, blood seeping between his fingers. The other Marine was inside the room, weapon drawn, but whoever had been there was gone. Corporal Davis lay on the floor beside his bed, pulled from the mattress, another IV line inserted into his arm. The bag hanging from the pole was different from what should have been there. Kate recognized the setup immediately. High-dose fentanyl, enough to cause respiratory depression in minutes. Dr. Torres was already working on Davis, pulling the line, administering Narcan, manually bagging him. Kate dropped beside her, checking pupil response, monitoring respirations. "How long has this been in?" Kate demanded. "Maybe 90 seconds. Torres gasped. The Marine said someone came through the ceiling access panel, dropped down, shot him, inserted the line, and disappeared back up before anyone could react. Davis gasped, chest heaving, as the Narcan reversed the opioid overdose. His eyes flew open, wild with fear and confusion. "Easy," Kate said, her voice dropping into the calm command tone she used to use in the desert. "You are safe. We have you." Davis grabbed her wrist with surprising strength. He said, "Tell Major Hayes. Room 412. Waiting." Kate's blood went cold. "Reynolds." She stood, but General Hargrove's voice came through the radio before she could move. "Major, do not go to 412. It is another feint. We have eyes on that room. Reynolds is secure. Nobody has approached." Kate stood in the hallway, forcing herself to think tactically instead of emotionally. Webb was moving through the ceiling, using access panels and ductwork to bypass the Marines on the ground. He could be anywhere, could strike anywhere. She looked up at the ceiling tiles, scanning for any sign of disturbance. "Marcus," she called out, loud enough to carry. "I know you can hear me." Silence. Just the sound of monitors and labored breathing from the wounded Marine. "This ends now," Kate continued. "You want to talk? Let us talk. Face to face." More silence, then faint but distinct a voice from somewhere above, still trying to give orders. "Major, you always did think you knew best." Kate's hands clenched into fists. "I made a decision at Al Jura. The only decision I could make. You know that. Do I?" Webb's voice seemed to come from everywhere and nowhere, distorted by the ductwork. "Or did you just choose wrong and refuse to admit it?" "5 people survived because of my choice," Kate said. "1 person died." Webb shot back. "Ryan died because you decided he was not worth saving." "That is not what happened." "Then what did happen?" "Major, explain it to me. Make me understand why my best friend bled out in the sand while you flew away." Kate closed her eyes. When she spoke, her voice was quiet but clear. "I triaged 11 wounded Marines. 6 were critical, 2 unstable to survive transport over rough terrain to the medevac point. 5 were serious but stable enough to move. I made the call to evacuate the stable patients and wait for a second helicopter for the critical ones. You were supposed to stay with me to provide security and medical support for those patients. And Ryan was supposed to live," Webb said. His voice cracked. "Ryan had a sucking chest wound and internal bleeding. Even if we had put him in that vehicle, he would have died en route from the trauma of movement. You know that. You were there. You saw his injuries. I saw you give up on him. I saw a man I could not save without killing 4 others in the attempt," Kate replied. "That is the reality of combat triage, Marcus. Sometimes there are no good choices, only terrible ones." A long pause. Then Webb spoke again, and his voice had changed. Colder, more controlled. "Then let us see how good you are at terrible choices, Major. Because I have placed devices in 2 rooms. Small, precise, built from medical supplies, like you taught me to improvise in the field. Room 412, Colonel Reynolds. Room 431, Private Torres." Kate's heart stopped. "You are bluffing." "Am I?" The hallway monitors suddenly switched, hijacked like the power system. 2 video feeds appeared. Reynolds in his bed, sleeping peacefully. Torres in hers, equally unaware. And in the corner of each frame, barely visible, something attached to the IV poles. Small boxes. Wires. Kate stared at the screens. Webb had done exactly what he threatened. And worse, he had done it while they were all focused on Davis. While she was in Torres' room checking for threats that were not there. He had moved through the ceiling, accessed both rooms, planted his devices, and vanished. 5 minutes, Webb said. That is how long until they trigger. You can defuse one. Maybe, but not both. So choose Major. Choose like you chose at Al Jura. Who lives, the colonel who praised you, or the innocent girl who has done nothing wrong. 2 countdown timers appeared on the screens. 5 Huzuro, already ticking down. 4:59, 4:58, 4:57. Doctor. Chen grabbed Kate's arm. We split up. I go to Torres, you go to Reynolds. We defused them both. Kate shook her head. The bombs might be real, but the scenario is rigged. If we split up, Webb picks us off one by one. That is what he wants. Chaos. Division. Panic. General Hargrove was on the radio coordinating with the bomb squad. 12 minutes out, he said. We will never make it in time. Dr. Torres was crying. Emma is 22 years old. She is my family. Kate, please, 4:30, 4:29, 4:28. Colonel Reynolds' voice came through the intercom from his room. He had woken up, seen the device, understood what was happening. Major Hayes, do not even think about choosing me. I am 47 years old. I have lived a full life. Save the girl. Kate stood in that hallway with everyone looking at her, waiting for her to make the call, waiting for her to choose, just like Al Jura, just like Webb wanted. The weight of it pressed down on her chest. She could see it in her mind, running to one room, working frantically to defuse a device she had no training to handle, maybe succeeding, probably failing, while someone else died in the other room. The math of suffering, the calculus of triage, the impossible choice. 4 Isaiards, 3:59, 3:58. And Kate realized something. Webb had spent 23 years planning this moment. He had studied her, knew how she thought, knew she would analyze the situation tactically, knew she would try to maximize survival, knew she would choose. But what if the entire premise was wrong? Kate looked up at the ceiling, at the access panel where Webb was hiding, where he could hear everything, see everything through his hijacked cameras. No, she said, clearly. General Hargrove turned. No, what? I am not playing this game. Marcus, Kate called out. I am not choosing. You do not have a choice. Webb's voice came back. In 3.5 minutes, 2 people die, or you save 1. Wrong, Kate said. In 3.5 minutes, either your devices detonate or they do not. But I am not making the choice for you. 3:15, 3:14, 3:13. Major, you cannot just stand there, General Hargrove said urgently. Watch me, Kate replied. She stood perfectly still in the center of the hallway, hands at her sides, eyes on the countdown timer. Dr. Chen stared at her. You are betting both their lives that Webb is bluffing. I am betting that Marcus Webb is not a murderer, Kate said. He is a wounded soldier looking for someone to blame. He wants me to feel guilty, to second-guess myself, to carry the weight of this choice the way he has carried Ryan's death. But I refuse. Kate, please, Dr. Torres begged. My cousin will live or die based on Marcus Webb's choice, Kate said gently. Not mine. I made my choice 23 years ago. I saved everyone I could. I triaged based on medical reality, not emotion. And I have carried the guilt of Ryan's death every single day since. But I will not carry guilt for refusing to play executioner now. 2:30, 2:29, 2:28. The hallway was silent, except for the quiet beeping of the countdown. Marines stood with weapons ready, but no targets to engage. Dr. Chen watched Kate with something between horror and awe. General Hargrove had stopped issuing orders because there were no orders to give. Kate stood in the eye of the storm and felt 23 years of running fall away. She had hidden because she could not face making another impossible choice, could not risk being responsible for another death, could not survive another Aljura. But standing here refusing to choose, she realized something fundamental. She had not been wrong at Aljura. She had been a doctor in an impossible situation, doing the best she could with the information and resources available. And no amount of guilt or second-guessing would change the outcome. Ryan died because war is brutal and random and unfair, not because Kate Hayes was not good enough or smart enough or compassionate enough. He died because sometimes people die, and there is no one to blame. Abdishern. 1 to 59. 1:58. Marcus Kate called out. Her voice was steady. You have spent 23 years hating me, and I understand why. I took away your hope that Ryan could be saved. I made a choice that felt like betrayal, but killing these people will not bring him back. It will just create more Marcus Webbs, more people carrying impossible guilt, more soldiers broken by wars that never really end. 1:30, 1:29, 1:28. Dr. Torres was openly sobbing. General Hargrove had his hand on his sidearm, ready to breach both rooms by force, even though they all knew it was too late. Kate never moved. She stood like she was rooted to the floor, trusting in her read of Marcus Webb, gambling everything on the belief that the brilliant, compassionate corpsman she trained would not cross the line into murder. 1 sold Asajo. 0:59. 0:58. You are wrong. Webb's voice came back, but it sounded less certain now, less cold. Maybe Kate said, but I would rather be wrong and maintain my principles than be right and become what you want me to be. A person who plays God and chooses who lives. I did that once. I will not do it again. 0:30. 0 to 29. 0 to 28. Someone was screaming. Maybe Dr. Torres. Maybe the wounded Marine. Maybe Kate's own mind. 0:15. 0:14. 0:13. Kate closed her eyes, not because she could not watch, but because she was sending a prayer to Ryan Porter and every other Marine she could not save, asking them to understand, to forgive, to let her finally let go. 0:10. 0:09. 0:08. If she was wrong, 2 people would die, and she would carry that weight. But she would carry it knowing she refused to let her trauma dictate her choices, refused to let Webb's pain become her punishment. 0:05. 0:04. 0:03. Somewhere above her in the dark spaces between floors, Marcus Webb made his own impossible choice. 0:02. 0:01. 0:000. The timers hit 0. Alarms beeped frantically. Everyone flinched, waiting for the explosion. Silence. The doors to both rooms unlocked electronically. The devices on the screens went dark. No detonation. No casualties. Both patients safe. Kate opened her eyes and felt her legs almost give out. She caught herself on the wall, breathing hard, heart hammering. A ceiling panel fell open 20 feet down the hallway. Marcus Webb dropped to the ground, landing heavily. He was older than Kate remembered. Gaunt, hollowed out by decades of carrying rage like a second skeleton. His hands were empty. No weapons. No remote triggers. Just empty hands and eyes that had cried themselves dry. Marines swarmed him immediately, weapons trained shouting commands. Webb did not resist. He simply stood there staring at Kate. You called my bluff, he said. Voice raw. Kate pushed off the wall and walked toward him slowly. I trusted that you were better than your anger. Webb's face crumpled. I wanted you to feel it. What I felt. Watching someone you love slip away because someone else decided they were not worth the effort. Ryan was worth every effort, Kate said quietly. But effort alone could not save him. Sometimes the wounds are too severe. Sometimes people die, and there is nothing anyone can do except bear witness and carry the memory. Tears streamed down Webb's face. I have hated you for 23 years. I know. I have hated myself for just as long. Webb looked at her with red-rimmed eyes. The bombs were never real, were they? You knew. Kate shook her head. I hoped, but I did not know. I just refused to let you force me into repeating my trauma, into making another choice that would destroy me. The Marines were cuffing Webb now, reading him his rights. FBI agent Sarah Mitchell had arrived and was coordinating with General Hargrove. Webb would be taken into federal custody, evaluated, charged, probably committed to a VA psychiatric facility rather than prison given his service record and clear mental health crisis. As they led him away, Webb stopped and looked back at Kate one more time. Does it ever stop hurting? He asked. The guilt. The what-ifs. Kate met his eyes with complete honesty. No. But you learn to carry it without letting it crush you. You learn that surviving is not the same as winning. And you find ways to honor the dead by living well. Webb nodded slowly. Then he was gone, escorted by Marines down the hallway and out of Kate's life, after 23 years of haunting it. Dr. Chen appeared at her side. That was the bravest or most reckless thing I have ever witnessed. Kate smiled without humor. Sometimes there is no difference. General Hargrove approached looking older than he had an hour ago. Major Hayes, what you did was either brilliant crisis negotiation or suicidal risk-taking. I am not sure which. Neither am I, Kate admitted. But it worked. This time, Hargrove said. Next time you might not be so lucky. There will not be a next time, Kate replied. Webb was the last ghost from Aljura, the last person carrying that much rage. The others either made peace or moved on. Hargrove studied her face. You just came back from the dead, saved a Marine colonel, prevented multiple murders, and faced down a man who has been planning your destruction for 2 decades. What happens now? Kate looked around the hallway, at the emergency lighting still casting everything in red, at the wounded Marine being treated, at the patients who survived because she refused to choose, at Dr. Chen, who had trusted her with his career and his surgical table. Now, she said slowly, I figure out how to stop running, how to stop hiding, how to be Catherine Hayes again instead of a ghost, pretending to be someone else. And Marcus Webb. What about him? Kate thought about the broken man being led away in handcuffs, about the brilliant corpsman who saved lives in the desert before grief turned him into something he never meant to become. He gets help, she said. Real help. The help he should have gotten 23 years ago when Ryan died. Therapy, treatment, support. Maybe he heals, maybe he does not. But at least he gets the chance. Dr. Torres approached, eyes still wet, but voice steady. Thank you for saving Emma, for saving all of them. Kate shook her head. I did not save anyone. I just refused to participate in my own destruction. That is the same thing Torres said. Maybe it was. Kate was too exhausted to argue philosophy. She had been running for 23 years, and in the last hour, she had finally stood still and faced everything she had been fleeing. The weight should have crushed her. Instead, it felt like setting down a burden she had carried too long. General Hargrove's radio crackled. Bomb squad had arrived. Power was being restored. The stairwell locks were being overridden. The hospital was returning to normal operations. Or as normal as possible after a hostage crisis involving a ghost surgeon and a revenge-driven corpsman. The emergency lights flickered, and then the regular fluorescence came back on harsh and bright after the dimness. Kate blinked against the sudden glare and saw herself reflected in the glass of a nearby door, still wearing surgical scrubs, still spotted with Colonel Reynolds' blood, hair falling out of its tie, face pale and drawn, but standing upright, standing firm, not running. For the first time in 23 years, Kate Hayes looked at her own reflection and recognized the woman staring back. The aftermath unfolded in waves. FBI agents arrived within the hour to process the scene and take formal custody of Marcus Webb. They moved through the surgical floor with practiced efficiency, photographing evidence, collecting statements, documenting every detail of what had transpired. Hospital administration hovered in tight clusters, oscillating between relief that the crisis had ended and barely concealed terror about liability implications. Someone would have to answer for how a disturbed veteran gained access to restricted areas, sabotaged medical equipment, and held an entire floor hostage. But that was a problem for lawyers and insurance companies. Kate had more immediate concerns. She sat alone in an empty patient room 3 doors down from where it had all happened. Still wearing blood-stained scrubs. Still feeling the adrenaline crash rolling through her system in waves of trembling exhaustion. Her hands shook now that the crisis was over, the way they always did after combat operations. During the emergency, her training took over. Afterward, her body remembered that she was human. The door opened without a knock. General Hargrove entered, followed by a woman in a dark suit who carried herself with the contained alertness of federal law enforcement. She was 40s, sharp-eyed with the kind of face that revealed nothing unless she wanted it to. Major Hayes, the general, said, "This is Agent Sarah Mitchell, FBI. She will be handling Marcus Webb's case." Kate nodded, but did not stand. Did not trust her legs yet. Agent Mitchell sat across from her, pulling out a tablet. "We will need your full statement, but before we begin the formal interview, I wanted to say something off the record." She paused, choosing words carefully. "What you did today probably saved Marcus Webb's life. If we had breached those rooms by force, if there had been actual explosives, we would have had no choice but to neutralize the threat with lethal force. Your refusal to engage on his terms gave us time, gave him time to make a different choice." Kate stared at her hands. "I did not do it to save Webb. I did it to save myself." "From what?" "From becoming the person he wanted me to be," Kate said quietly. "Someone who makes impossible choices and gets destroyed by them. I did that once. I will not do it again." General Hargrove pulled up a chair. "Catherine, we need to discuss what happens next. Webb will face federal charges. Multiple counts of attempted murder, assault on military personnel, sabotage, stalking, unauthorized access to secure facilities. But given his service record and clear psychiatric crisis, Agent Mitchell is recommending psychiatric evaluation and commitment to a VA facility rather than federal prison." Kate looked up. "He needs treatment, not punishment." "I agree," Mitchell said. "Webb is not a terrorist or a career criminal. He is a decorated combat veteran who never received adequate mental health support after a traumatic incident. The system failed him, and that failure created this situation." "The system failed both of us," Kate said. "They declared me dead, rather than deal with the controversy of Al Jura. They discharged Webb, rather than treat his PTSD properly. And for 23 years, we both suffered because no one wanted to acknowledge that sometimes war damages people in ways that do not show up on medical scans." General Hargrove leaned forward, elbows on knees. "That is going to change. Your case, Webb's case. They are going to force the Pentagon to reevaluate how we handle moral injury and psychological trauma in combat medical personnel. I am already drafting recommendations." Kate felt a bitter laugh escape. It only took 2 ruined lives and a hostage crisis to get their attention. "Better late than never," Hargrove replied, without irony. Agent Mitchell tapped her tablet. "Major Hayes, the other incidents, Captain Daniel Reeves, Dr. Sarah Kim, Sergeant Rodriguez, the others, Webb targeted. He confessed to orchestrating all of them during initial intake, but he insists they were accidents he arranged, psychological pressure campaigns, not direct murder attempts." "Do you believe him?" Kate considered this carefully. Yes, because Marcus Webb was never a killer. He was a healer who got twisted by grief into someone who wanted others to hurt the way he hurt. But crossing the line from causing pain to causing death, that is a threshold he could not cross. That is why the bombs today were fake. He wanted me to choose to suffer to feel responsible, but he did not actually want blood on his hands. Mitchell made notes. That assessment matches our psychological profile. Webb will undergo extensive evaluation, but preliminary diagnosis suggests complicated grief disorder, PTSD, and obsessive fixation, all treatable with proper intervention. How long will he be committed? Kate asked. Years, Hargrove said. Possibly the rest of his life, depending on his response to treatment. But he will be safe, cared for, given the support he should have received decades ago. Kate closed her eyes. And the Marines he hurt, Reynolds, Davis, Torres, all stable. Hargrove replied. Reynolds will make full recovery. Davis is responding well to treatment. Torres was never in actual danger. Webb's plan was always about psychological warfare, not body count. The door opened again. Dr. Robert Chen entered carrying 2 cups of coffee. He handed one to Kate without asking if she wanted it. She took it gratefully, wrapping both hands around the warmth. Hospital administration wants to meet with you, Chen said to Kate. They have questions, many questions, about your credentials, your background, why you were working under a nursing license when you have surgical training. Kate sipped the coffee. It was terrible, overbrewed, and bitter. Perfect. What did you tell them the truth? That you saved Colonel Reynolds' arm when I was about to amputate. That you prevented multiple deaths during Webb's crisis. That you are the most skilled trauma surgeon I have ever watched operate. He sat down beside her. They want to offer you a position. Kate looked at him. As what trauma attending? Surgical director if you want it. Full credentials, expedited license renewal, whatever support you need to return to active practice. Kate shook her head slowly. I have not worked as a surgeon in 23 years. You worked as one today, Chen replied. And you were brilliant. Fast decisions, clean technique, perfect crisis management. Those instincts do not disappear. They just go dormant. I am a nurse now. That is who I have been for 2 decades. Chen set down his coffee and turned to face her directly. Kate, I dismissed you this morning, barely learned your name. Treated you like you were invisible because your badge said RN instead of MD. And because of my arrogance, I almost destroyed a man's career and life. You stopped me not by demanding respect, but by demonstrating competence. That is leadership. That is exactly what this hospital needs. Kate felt something crack inside her chest. I do not know if I can do this. Every time I pick up a scalpel, I see Al Jura. I see the men I could not save. I see Ryan Porter bleeding out in the sand. Then maybe it is time to see something else, Chen said gently. Maybe it is time to see the construction worker whose arm you will save tomorrow, the accident victim next week, the hundreds of patients over the coming years who will live because Catherine Hayes came back from the dead and remembered who she was always meant to be. Agent Mitchell cleared her throat. Major Hayes, before you make any decisions about your future, there is something else you should know. We found Webb's journals, 23 years of them. Detailed plans, surveillance notes, psychological analysis. She paused. He wrote about you constantly, but in the most recent entries from the last few months, something changed. He started questioning himself, wondering if he was wrong about you, if his hatred had consumed him so completely that he could not see clearly anymore. What made him question? Kate asked. He watched you work, Mitchell said. Not just the day of Reynolds' surgery. For weeks before that. He posed as hospital staff, observed you interacting with patients, saw how you treated people with compassion and skill. And he realized that the monster he had built you up to be in his mind did not match the woman he was watching. That created cognitive dissonance, made him doubt his own narrative. So he escalated, Kate said. Forced the confrontation because he needed resolution one way or another. Exactly, Mitchell confirmed. Today was never about killing anyone. It was about forcing you to prove him right or wrong. To either confirm that you were the cold, calculating surgeon who valued efficiency over humanity, or to show him that you were something else entirely. And I showed him that I refuse to play that game, Kate said. That I will not let his trauma define my choices. Which is why he stood down. Hargrove added. Because you gave him an exit he did not know existed. A way to stop without having to admit he was wrong. Just that the question was more complicated than he thought. The room fell quiet. Walt drank her terrible coffee and felt the weight of 23 years pressing down on her shoulders. Not crushing anymore, just heavy, a burden she would carry but no longer hide from. I want to see him, she said suddenly. Webb. Before they transfer him to long-term care. I want to talk to him. Mitchell frowned. That is highly irregular. He is a federal prisoner. You are a victim of his crimes. I am also the only person who understands what he has been carrying, Kate replied. We both survived Aljura. We both got damaged by it. If there is any chance for him to heal, it starts with us facing each other honestly, instead of through the lens of 23 years of rage and guilt. General Hargrove considered this. I can authorize it. One meeting, supervised but private. Would that help? I do not know, Kate admitted. But I have to try. The meeting was arranged for 3 days later after Webb's initial psychiatric evaluation was complete. The VA facility was modern, designed to feel therapeutic rather than punitive. Soft colors, natural light furniture that suggested comfort rather than restraint. But the security was evident in the locked doors, the cameras in every corner, the way staff moved with practiced awareness of potential threats. Webb sat in an evaluation room waiting for her. He looked older than his 45 years. The rage that had animated him for decades was gone, leaving behind a hollowed-out shell of a man who had finally stopped running and found nothing but exhaustion on the other side. When Kate entered, he did not stand. Did not react, just watched her with eyes that had cried themselves empty. She sat across from him. A psychiatrist observed from the corner, ready to intervene if needed. But Kate suspected there would be no violence here. Webb had spent all his fury. What remained was just grief. You came, Webb said. His voice was rough, unused. I said I would. Why? Because you deserve to be heard, Kate replied. For 23 years you have been carrying Ryan's death alone, turning it into rage because rage felt better than grief. But no one ever let you just grieve. So I am here to listen. Webb stared at his hands cuffed loosely in front of him. I have hated you for so long. It became who I was. Marcus Webb, the man destroyed by Major Hayes's decision. I built my entire identity around that hate. I know, Kate said. I did something similar. I became Kate Hayes, the nurse, the invisible professional, the woman with no past. We both created new identities to cope with Aljura. Yours was anger. Mine was disappearing. I wanted you to suffer, Webb said. Wanted you to feel what I felt. Helpless. Watching people die. Unable to save everyone. Did it work? Kate asked. Do you feel better now? Webb laughed a hollow sound. No. I feel empty. Like I spent 23 years climbing towards something and when I finally reached it, there was nothing there. Kate leaned forward slightly. Marcus. Tell me about Ryan. Not the day he died. Before that. Who was he? Webb's expression shifted, surprise flickering across his features. No one has asked me that in 2 decades. I am asking now. Slowly, haltingly, Webb began to talk. About Ryan Porter, the kid from Michigan who joined the Marines to pay for college, who was brilliant with languages, could speak Arabic well enough to negotiate with local tribal leaders, who wanted to be a teacher after his service ended, who played guitar badly but enthusiastically, who made everyone laugh even in the worst conditions, who was Webb's best friend, his brother, in every way that mattered. Kate listened without interrupting. Let Webb paint a picture of a person instead of a casualty. Let Ryan Porter become real instead of just a name attached to guilt. He saved my life once, Webb said. Pulled me out of a burning Humvee after an IED strike. Burned his hands doing it. Still has the scars. He stopped realizing his verb tense. Had the scars. When he died, Kate said gently, "What were his last words?" Webb looked up sharply. "How did you know he said anything?" "Because I have read casualty reports from that day," Kate replied. "Because I know you were with him at the end." Webb's eyes filled with tears. "He told me to take care of his sister, to tell her he loved her, to make sure she finished college because he would not be there to help anymore." "Did you?" Webb nodded. "I found her, told her everything, stayed in touch for years until my PTSD got so bad I cut everyone off. She is a teacher now, high school English, married, 2 kids, lives the life Ryan wanted for himself. Then his death was not meaningless," Kate said. "He died in combat, yes, but his sister thrived because you honored his last request. That matters. It does not bring him back." "No," Kate agreed. "Nothing brings back the dead, but we can honor them by living well, by helping others, by transforming our grief into something that serves the living." Webb wiped his eyes roughly. "You sound like a therapist." "I sound like someone who has spent 23 years learning how to survive impossible guilt," Kate replied. "I made the right medical decision at Al Jura. Tactically, strategically, by every measure of triage protocol, I chose correctly. 5 stable patients evacuated, all survived. 6 critical patients remained behind. 5 survived when the second medevac arrived. Only Ryan died. 91% survival rate." Webb flinched at the statistics. "But that is not the whole truth," Kate continued. "The whole truth is that every night for 23 years, I have seen Ryan's face. I have second-guessed my decision. I have wondered if there was some other option I missed, some way to save everyone. And the not knowing the endless what-ifs, that is what almost destroyed me." "So what changed?" Webb asked. "How did you survive it?" "I stopped running," Hattie said. "I stopped hiding behind a fake identity and a career that let me help without leading. I faced the fact that I am a surgeon, that I make life and death decisions, that sometimes people die despite my best efforts, and I have to live with that. And today, when I gave you that impossible choice, today I chose differently," Kate replied. "I chose not to let your trauma dictate my actions. I chose to trust that you were better than your worst impulses. And I chose to believe that refusing to play God again was more important than anything else." "You gambled both their lives on that belief," Webb said. "Yes, and I would do it again. Because the alternative was becoming the person you wanted me to be. Someone broken by impossible choices. Someone who carries guilt like a weapon. I refuse to live that way anymore." Webb was quiet for a long time. Then he asked the question that had haunted him for decades. "Do you think I can ever forgive you?" Kate met his eyes. "I do not know, but I think you can stop hating me. I think you can separate Ryan's death from my decision. I think you can understand that tragedy sometimes has no villain, just circumstances beyond anyone's control. And I think if you do that work, if you grieve properly instead of weaponizing your pain, you might find peace." "What about you?" Webb asked. "Can you forgive yourself?" Kate smiled sadly. "I am working on it. Every day. It gets a little easier. Not because the guilt goes away, but because I am learning to carry it without letting it define every choice I make. They sat in silence for a moment. Two people damaged by the same day, finally talking honestly instead of through layers of rage and shame. "What happens to me now?" Webb asked. "You stay here," Kate said. "You get treatment. Real treatment. Therapy, medication, if needed, support from people who understand combat trauma. You do the work of healing, and maybe eventually you help other veterans who are struggling the way you struggled. You think I can?" "Marcus, you were one of the best combat medics I ever served with," Kate said firmly. "You saved lives. Many lives. Your skill and compassion kept Marines alive in conditions that would have broken lesser men. Do not let Al-Jura be the end of your story. Let it be the turning point." Webb looked at her with something that might have been hope. Fragile and tentative, but real. "I do not know if I can do this," he said. "Neither do I," Kate admitted, "but we both try anyway, because the alternative is spending the rest of our lives in the desert, reliving the same day, never moving forward." As she stood to leave, Webb spoke one more time. "Major Hayes." He used her rank deliberately. "I am sorry. For everything I did. Everyone I hurt. The years I wasted." Kate paused at the door. "I am sorry too. For the choice I made. For the pain it caused you. For not being able to save Ryan." She turned back to face him. "But I am not sorry for trying my best under impossible circumstances. And I hope someday you will not be sorry for surviving when he did not." She left before he could respond. Let those words be the last ones between them for now. They would both need time to process, to heal, to figure out who they were without the weight of 23 years of mutual destruction. Outside, General Hargrove waited. "How did it go?" he asked. "Honestly," Kate replied. "We talked honestly for the first time since the desert." "Think he will make it," Kate considered. "I think he has a chance now. Before he was just existing, consumed by rage. Now he has something else. Grief, yes, but grief can heal. Rage just burns." They walked through the facility together, past therapy rooms and common areas where veterans gathered in various stages of recovery. This was where Webb would spend the next phase of his life. It could be worse, Kate thought. At least he would be cared for. At least someone would finally help him carry what he had been carrying alone. General Hargrove stopped before they reached the exit. "Catherine, I have spoken with Pentagon leadership. They want you to consult on combat medical protocols, specifically on triage procedures, psychological support for medical personnel, and better integration of mental health services into field operations." Kate raised an eyebrow. "They want me to teach them how to avoid creating more Marcus Webbs." "Essentially, yes. I am not military anymore." "General, you never stopped being military," Hargrove replied. "You just stopped wearing the uniform. But your expertise, your experience that does not disappear because you changed careers. The question is whether you are willing to share it." Kate thought about this. About the young doctors and medics being deployed to war zones without adequate preparation for the psychological toll. About the Marcus Webbs of the future who would make impossible choices and need support to survive them. "I will consult," she said finally. "Limited basis, maybe 1 week per quarter, but I will not return to active duty. My place is in the civilian world now." "That is all we are asking," Hargrove said. He extended his hand. "Welcome back, Major Hayes." Kate shook it firmly. "Dr. Hayes," she corrected gently. "Let us use the right rank." Hargrove smiled. "Dr. Hayes it is." She left the VA facility feeling lighter than she had in years. Not cured, not absolved of all guilt, but functional in a way she had not been since 1991. The conversation with Webb had not resolved everything. Grief and trauma did not work that way. But it had opened a door. created space for both of them to move forward instead of remaining frozen in the desert. Her phone buzzed. A text from Dr. Chen. Hospital board meeting tomorrow, 10 a.m. They want to formalize your position. Bring your CV. Also, Colonel Reynolds is asking for you. Says he has something important to discuss. Kate stared at the message. Her CV. She had not updated it in 23 years. Everything after 1992 was nursing credentials, not surgical experience. She would need to reconcile those two identities. Figure out how to present Catherine Hayes, the combat surgeon, and Kate Hayes, the nurse, as the same person instead of separate fragments. But that was a problem for tomorrow. Today, she needed to see Colonel Reynolds. She found him in his hospital room, arm bandaged but mobile, sitting up and looking far better than he had any right to after everything he had been through. When Kate entered, he smiled broadly. "Ma'am," he said, "or should I say Dr. Hayes, now that your secret is out?" Kate smiled back despite herself. "Jim is fine. We are past formalities." Reynolds gestured to the chair beside his bed. "I wanted to thank you properly. For my arm, yes. But more than that. For reminding me why I serve." Kate sat. "I do not understand. At Checkpoint Whiskey, Reynolds said you made a choice that saved my life. I was yellow tag. Borderline. Could have gone either way. You decided I was stable enough to evacuate. If you had chosen differently, I would have stayed behind with the critical patients. Maybe survived, maybe not. But you gave me a chance." He flexed his fingers, demonstrating the arm that worked, because Kate had refused to let Dr. Chen amputate. "Because of that choice, I got to come home. I got married, had 3 kids, made colonel, commanded 2 deployments where I brought every single Marine home alive. That is 87 Marines who are alive because you saved me at Checkpoint Whiskey. 87 families who did not lose sons and daughters and husbands and wives." Kate felt her throat tighten. Webb could not see that Reynolds continued. He only saw Ryan, only saw the one we lost. But the 5 of us you evacuated. We have lived full lives. We have loved and built families and served with honor. We have tried to make our survival mean something. Reynolds reached out and took Kate's hand. "Ryan Porter's death was a tragedy," he said firmly. "But it was not your fault. Combat creates impossible situations. Someone has to make the hard calls. You were 29 years old, barely older than the Marines you were trying to save, making decisions that general officers struggle with. And you got it right, Kate. You saved as many as could be saved. That is all anyone can ask." Kate could not speak, could only nod as tears blurred her vision. "So stop carrying that guilt," Reynolds said. "Stop punishing yourself for being human in an inhuman situation. Honor Ryan by living well, by using your skills to save more lives, by being the surgeon you were always meant to be." "How do I do that?" Kate whispered. "You already started," Reynolds replied. "You stood in that hallway and refused to let Webb force you into repeating your trauma. You chose yourself, your principles, your healing over his demand for revenge. That took more courage than anything you did in the desert." He released her hand and leaned back against his pillows. "The hospital wants to hire you," Chen told me. "They want you to direct trauma surgery, teach residents, build programs. You should say yes." "I have not operated in 23 years, Kate said. "What if I have lost my edge?" "You saved my arm with the precision of someone who never stopped practicing," Reynolds countered. "The skills are still there. You just need to trust yourself again." Kate wiped her eyes. "What if someone dies? What if I make the wrong call?" "Then you make the wrong call," Reynolds said, "and you learn from it and do better next time. That is medicine. That is life. Perfection is impossible. All you can do is try your best with the information you have and accept that sometimes it will not be enough." Kate stood and walked to the window. Outside, San Diego stretched out under clear California sky. Somewhere in this city, Marcus Webb was beginning treatment. Somewhere else, Dr. Chen was preparing for tomorrow's board meeting. General Hargrove was drafting Pentagon recommendations. And here in this room, Colonel James Reynolds was trying to give her permission to stop running. "I will think about it," Kate said. "Good," Reynolds replied. "And while you are thinking, consider this. Every patient you save from this point forward is another life added to the ledger. Another person who gets to go home to their family because Catherine Hayes decided to step out of the shadows and use her skills again." Kate turned to face him. "You make it sound heroic. It is not. It is just work. Work that saves lives." Reynolds corrected. "Work that matters. Work that honors everyone we lost by making sure their sacrifice meant something." Kate wanted to argue, to list all the reasons why she was not ready, why she might fail, why the risk was too great. But looking at Reynolds at the arm that would have been amputated without her intervention, she could not find the words. Maybe he was right. Maybe it was time to stop hiding, to stop punishing herself, to step back into the operating room, not as penance, but as purpose. "Thank you," she said finally, "for believing in me when I could not believe in myself." Reynolds smiled. "That is what brothers and sisters in arms do, ma'am. We carry each other when the weight gets too heavy." "You carried me at Checkpoint Whiskey. I am just returning the favor." As Kate left his room, she felt something shift inside her chest. Not a sudden transformation, not a complete healing, but a small movement, a loosening of the vice that had gripped her heart for 23 years. Tomorrow she would meet with the hospital board. She would update her CV. She would make decisions about her future instead of just reacting to her past. But tonight, she went home to her small apartment and did something she had not done in decades. She wrote in a journal. Not to record events, but to process emotions. She wrote about Webb, about Reynolds, about Al Jura, and everything it had cost. She wrote about Ryan Porter and the 87 Marines who lived because she made the hard choice. And then she wrote a letter to herself. To the 29-year-old combat surgeon who stood in the desert and made an impossible decision and spent 23 years paying for it. She told that younger version of herself that she did her best, that it was enough, that she could finally forgive herself for being human. She finished writing and closed the journal. Tomorrow would bring new challenges. But tonight, for the first time in 23 years, Kate Hayes slept without seeing the desert, without hearing the helicopters, without watching Ryan Porter die in an endless loop. She dreamed instead of an operating room, of patients saved, of residents taught, of a future built from the rubble of trauma into something that mattered. The ghost was fading. The surgeon was returning. And maybe, just maybe, Catherine Hayes could learn to carry both identities without breaking under their combined weight. The work would be hard. The healing would be slow. But she was finally ready to begin. 3 weeks passed before Kate stood in an operating room as the lead surgeon. 3 weeks of meetings with hospital administration of license renewal paperwork, processed at expedited federal speed thanks to General Hargrove pulling strings at the Pentagon of credentialing interviews, where she answered questions about her 23-year gap in surgical practice with an honesty that felt both terrifying and liberating. 3 weeks of observing current techniques, reviewing recent literature, spending hours in the surgical skills lab, reacquainting her hands with tools and protocols that had evolved since she last operated. Dr. Chen became her advocate during this transition. He arranged for Kate to shadow procedures, to consult on complex cases, to gradually rebuild confidence that her skills were still sharp beneath the rust of disuse. He was patient when she second-guessed herself, encouraging when doubt crept in, protective when other surgeons questioned whether someone with her history could handle the psychological pressure of trauma surgery. The whispers followed her through the hospital corridors. The rookie nurse who was actually a combat surgeon, the woman who had been declared dead for 23 years. the doctor who saved Colonel Reynolds' arm when the attending wanted to amputate, the surgeon who faced down a vengeful veteran and refused to choose who lived and who died. Kate ignored the whispers. She had spent 2 decades hiding. She would not waste energy now worrying about reputation. The hospital board meeting had been surprisingly straightforward. They offered her a position as trauma attending, with the option to move into surgical director role within a year. The salary was generous, the terms were flexible, and most importantly, they approved her proposal to create a support group for medical professionals dealing with moral injury, ethical dilemmas, and the psychological weight of difficult cases. Kate negotiated one additional term. She wanted to consult with the VA and Pentagon on military medical protocols 1 week per quarter. The board agreed without hesitation. Having a surgeon with combat experience enhanced the hospital's credentials. They framed it as community service and good publicity. Kate framed it as penance and purpose intertwined. Her first surgery back was scheduled for a Tuesday morning. Motorcycle accident victim, 34 years old, multiple fractures to left leg, vascular compromise, compartment syndrome developing. The parallels to Colonel Reynolds were obvious and deliberate. Dr. Chen had arranged this case specifically because he knew Kate needed to prove to herself that she could handle the pressure without falling apart. The night before, Kate barely slept. She lay in bed staring at the ceiling, feeling the familiar pre-combat anxiety she remembered from the desert. The hyper-awareness, the mental checklist running through every possible complication. The knowledge that tomorrow someone's life would depend on her hands being steady and her mind being clear. She arrived at the hospital before dawn, changed into scrubs that felt both foreign and familiar. Stood at the scrub sink letting muscle memory take over as she prepared her hands with the same methodical precision she had used 1,000 times before. When she entered operating room 3, the same room where everything had started with Colonel Reynolds, the team was already assembled. Dr. Chen positioned himself as first assist, a deliberate reversal of traditional hierarchy. Dr. Amanda Torres scrubbed in as second assist, eager to learn. The circulating nurse and scrub tech moved with practiced efficiency, setting up instruments, checking equipment, creating the controlled environment where surgery could happen. The patient, Michael Brennan, lay unconscious on the table. His left leg was swollen, discolored, the classic presentation of compartment syndrome, threatening to steal circulation and function. Kate studied the imaging, the pressure readings, the timeline of injury. All the data pointed to the same conclusion she had reached with Reynolds. This was salvageable. But the window was closing. She took her position at the surgical field, adjusted the overhead light, that same small gesture that had revealed her expertise to Dr. Chen weeks ago. The team watched her with a mixture of curiosity and respect. They had heard the stories. Now they would see if the legend matched reality. Scalpel, Kate said. Her voice was steady. Her hand was steady. The trembling from weeks of anxiety vanished the moment she touched the instrument. The first incision was perfect, clean, controlled, exactly the right depth and angle. Kate released the anterior compartment and watched dark blood well up, sluggish and pressurized, but not the bright spray of arterial damage. The monitors showed pressure dropping immediately. "Suction," she said calmly. Dr. Torres responded instantly. Kate worked through the remaining compartments with the efficiency of someone who had never stopped practicing. Each release was calculated to maximize decompression while minimizing additional trauma. She narrated her technique for the residents observing from the gallery, explaining not just what she was doing, but why, sharing the decision-making process that turned textbook knowledge into practical skill. "Second compartment, lateral approach," she announced. "Watch the pressure monitor. You will see the numbers drop as we relieve the mechanical lock." The surgery took 47 minutes. When Kate stepped back and checked circulation, Michael Brennan's toes were pink. His dorsalis pedis pulse was strong. The leg that had been minutes from potential amputation was saved. Dr. Chen checked the final measurements and looked at Kate with undisguised admiration. That was textbook perfect. Better than textbook. That was artistry. Kate stripped off her gloves and allowed herself a small smile. That was training and practice. Nothing more. It was extraordinary, Dr. Torres said quietly. I have never seen anyone work that fast, with that much precision. The team dispersed to close up and transfer the patient to recovery. Kate stood at the scrub sink washing her hands and feeling something she had not felt since 1991. Pride. Not arrogance or self-congratulation, but simple satisfaction in work done well. She was a surgeon again, not because circumstances forced her to be, but because she chose to be. Dr. Chen found her in the surgeon's lounge an hour later. Kate was reviewing the post-op notes, making sure every detail was documented properly. You did it, he said, sitting down beside her. First solo surgery in 23 years, and you made it look effortless. It was not effortless, Kate replied. I barely slept last night. I kept running through every possible complication. That is called being a good surgeon, Chen said. The day you stop worrying is the day you should retire. Kate closed the chart. Thank you for believing in me, for giving me this chance. I should be thanking you, Chen said. Watching you operate reminded me why I went into medicine. Not for the status or the salary or the title. To help people. To use knowledge and skill to fix what is broken. Somewhere along the way I forgot that. You helped me remember. Kate deflected the compliment but accepted it more gracefully than she would have a month ago. She was learning to take credit for her accomplishments without feeling like it betrayed the people she could not save. The support group she had proposed started the following week. Kate expected maybe 5 or 6 people to show up. 12 came to the first meeting. Doctors, nurses, physician assistants, respiratory therapists, all carrying weight they had no place to set down. They met in a small conference room on Tuesday evenings. Kate did not position herself as an expert or therapist. She facilitated discussion. She shared her own story selectively, offering it as example rather than instruction. She created space where medical professionals could admit that sometimes medicine breaks your heart, where they could process the weight of choices that have no perfect answer. A young emergency physician talked about the night she had to choose which of 2 coding patients got the last ventilator. An ICU nurse described the guilt of withdrawing life support from a patient she had cared for weeks. A paramedic spoke about the accident scenes that still played in his mind years later. Kate listened to all of them and recognized herself in every story. The impossible choices, the second-guessing, the fear that one wrong decision would haunt you forever. She did not offer easy answers because there were none, but she offered validation. The understanding that carrying guilt did not make you a bad medical professional, it made you a human one. By the 4th meeting, attendance had grown to 23. Word was spreading through the hospital that someone finally understood, that there was a place to acknowledge that saving lives sometimes costs pieces of your own soul. Kate also made good on her promise to visit Marcus Webb monthly. The VA psychiatric facility became a familiar route. She would sit across from him in that same evaluation room and they would talk. Not about revenge or rage anymore, about healing, about grief, about building something from the rubble. Webb was making progress. Slow, halting, but real. He participated in group therapy. He took his medications. He was learning to separate Ryan Porter's death from Kate's decision. To understand that tragedy does not always have a villain, sometimes just circumstances beyond anyone's control. In their 3rd meeting, Webb asked Kate if she thought he could ever make amends for what he did, for the people he hurt, the years he wasted on revenge. Kate had thought about this question carefully before answering. Amends are not about erasing the past, she said. They are about choosing differently in the future. You cannot undo the harm you caused. but you can prevent future harm. You can use your experience to help other veterans navigate PTSD and moral injury. You can transform your pain into expertise that serves others. Webb absorbed this slowly. The VA is asking if I would be interested in peer support training, working with other combat veterans who are struggling. What did you tell them I said I would think about it? Webb paused. Do you think I am capable of helping people? After everything I did? Marcus, you were one of the best combat medics I ever served with, Kate said firmly. You saved lives. Many lives. Your skill and compassion kept Marines alive in conditions that would have broken lesser men. That person is still in you, underneath the grief and rage. You just have to choose to be him again. What if I fail? What if I hurt someone? Then you fail, and you learn, and you try again, Kate replied. That is what healing looks like. Not a straight line upward, but a messy process of trying and failing and trying again. Is that what you are doing? Webb asked. Trying again. Every day, Kate said. Some days are better than others, but I keep showing up, keep operating, keep helping people. And slowly it gets easier to carry what happened at Al-Jura without letting it crush me. Do you still see Ryan's face? Yes, Kate admitted. Probably always will. But I also see Colonel Reynolds now, and Michael Brennan, the motorcycle accident victim whose leg I saved last week. And the 14 patients from a mass casualty incident yesterday who got to go home to their families. The ghosts multiply, but they are not all tragic anymore. Some of them are victories I earned by refusing to give up on myself. Webb was quiet for a long time. Then he said something that surprised them both. Thank you for not giving up on me either. Kate felt her throat tighten. You are doing the work, Marcus. I am just bearing witness to it. That matters more than you know, Webb replied. Kate also received unexpected visitors during those weeks. 3 of the 5 Marines she had evacuated from Al-Jura, besides Reynolds, tracked her down through military channels. They came separately, each carrying photographs of their families, their lives, their decades of living that existed because Kate made a hard call under fire. The first was Michael Chen, no relation to Dr. Robert Chen, a former sergeant who now ran a construction company in Arizona. He brought pictures of his wife and 4 children, ranging from age 22 down to 14. We would not exist without you, he said simply, gesturing to the photos. My kids, my life. All of it happened because you got me out of that desert alive. Kate studied the pictures. A whole family, grandchildren too in some of the photos. An entire network of human connection that would have been erased if she had made a different choice. Did you know Ryan Porter? Kate asked. Yeah, Chen replied. Good guy, talented linguist, wanted to be a teacher. His voice softened. His death was a tragedy. No question. But ma'am, with respect, you did not kill him. War killed him. The IEDs that hit our convoy killed him. The insurgents who kept us pinned down killed him. You did everything humanly possible to save everyone, and you saved 10 out of 11. That is not failure. That is heroic. It did not feel heroic, Kate said quietly. It felt like playing God. Chen leaned forward. I have made hiring and firing decisions that affected people's livelihoods, their ability to feed their families. I have had to choose which employees to promote and which to let go during economic downturns. Every choice has consequences. Every decision affects lives. That does not make us God. It makes us responsible humans doing our best with imperfect information. He pulled out one more photo. Ryan's sister, the teacher. Kate recognized her from Webb's description. Her name is Sarah Porter Chen said. She teaches English at a high school in Michigan. She knows what happened at Al-Jura. She knows you made the triage call. and she asked me to tell you something if I ever found you." Kate braced herself. She said, "Thank you," Chen continued. "Because the 5 Marines you saved went on to bring home dozens more. Because your decision saved not just those 5 lives, but all the lives they protected afterward." She said Ryan would have wanted it that way, would have understood that in war, sometimes you save who you can and grieve the rest. Kate felt tears she had been holding for weeks finally break free. Chen handed her a tissue without comment. The second visitor was Maria Santos, former corporal, now a police detective in San Diego. She had been one of the yellow tags evacuated, despite protests that she could fight through her injuries. "You probably do not remember me," Santos said. "I was unconscious for most of the evac." "I remember everyone," Kate replied. Shrapnel wounds to abdomen and left arm, possible internal bleeding, blood pressure dropping but stable. "You were borderline between yellow and red." Santos nodded slowly. "I found out later you argued with another medic about my tag. He wanted to mark me red. You said I was tough enough to make the transport." "I said your vitals were stable enough," Kate corrected. "But yes, there was debate." "You were right," Santos said. "I made it. Had surgery in Germany. Full recovery. And I have spent the last 20 years protecting people as a cop because you gave me the chance." She showed Kate her detective badge, her commendations photos of arrests and convictions. Domestic abusers taken off the streets. Drug dealers shut down. A human trafficking ring broken up. "That is 117 people directly helped by cases I worked," Santos said. "And that is just the documented ones. How many lives did I touch indirectly? How many people are safer because you saved me that day?" Kate stared at the evidence of a career built on the foundation of a triage decision made under fire. "I never thought about the ripple effects," Kate admitted. "Most people do not," Santos replied. "But every life saved creates more life, more good, more possibility. You did not just save 5 Marines. You saved everyone those 5 Marines went on to help." The third visitor hit hardest. Robert "Bobby" Morrison, former Lance Corporal, now a hospice nurse in Oregon. He came bearing no photographs, no evidence of dramatic accomplishments. Just a quiet man who sat across from Kate and said 7 words that changed everything. "You taught me how to let go." Kate looked at him questioningly. "At Al Jura," Morrison explained, "I watched you make the hardest call anyone can make. You looked at 11 dying men, and you chose who to fight for and who to release, and it destroyed you. I could see it in your eyes even then. But you did it anyway because it was necessary." He leaned forward. "I became a hospice nurse because of you," Morrison said. "Because I learned that sometimes the greatest compassion is not fighting to the bitter end. Sometimes it is recognizing when someone is suffering and helping them find peace. You showed me that in the desert. You showed me that letting go with dignity is not the same as giving up." Kate felt something shift in her chest. All these years, she had seen Al Jura as her greatest failure, but Morrison saw it as a lesson in compassionate triage, in recognizing limits, in making space for death when death was inevitable. "Did Ryan Porter die peacefully?" Kate asked, the question she had never dared voice. Morrison nodded. Webb was with him, held his hand. Ryan knew he was not alone. That is all anyone can ask for at the end. Kate closed her eyes and felt a weight she had carried for 23 years finally begin to lift. Not disappear, just lighten, enough to breathe around. These 3 visitors, along with Colonel Reynolds, represented a truth Kate had been unable to see through her guilt. That her decision at Al Jura had not just saved 5 lives. It had saved the potential of those lives, the families they would create, the people they would help, the good they would do, the ripples spreading outward through decades. She could not bring Ryan Porter back, could not undo his death or ease Webb's grief or change the mathematical reality of combat triage. But she could accept that she had done her best. That her best had saved multitudes, even if it could not save everyone. 6 weeks after returning to surgical practice, Kate stood in operating room 3, preparing for her 5th solo case. The fear had not disappeared entirely. She still lost sleep before difficult surgeries, still ran through contingency plans and worst-case scenarios. But now it felt less like terror and more like appropriate professional concern. Dr. Chen scrubbed in beside her again, but this time as a colleague rather than supervisor. They had developed an easy working relationship built on mutual respect and shared commitment to excellence. "Ready?" Chen asked as they positioned themselves around the patient. "Ready," Kate confirmed. The surgery was complex. Multi-trauma from a construction accident, crush injuries, vascular damage. The kind of case that required speed and precision and the ability to make quick decisions as conditions changed. Kate worked with the focused intensity she remembered from the desert, assessing, prioritizing, responding to complications as they arose. Dr. Torres assisted with growing competence, asking smart questions, learning the decision-making process alongside the technical skills. 3 hours later, the patient was stable, injuries repaired, prognosis good. The team dispersed exhausted but satisfied. In the surgeon's lounge afterward, Dr. Chen handed Kate a coffee. "You are getting faster," he observed, "more confident." "Muscle memory," Kate replied. "The skills were always there. I just had to trust them again." "It is more than that," Chen said. "You are teaching us as much as you are operating. The way you think through problems, the way you stay calm under pressure, the way you make hard calls without freezing up. That is leadership." Kate sipped her terrible hospital coffee and felt grateful for its familiar bitterness. "I am just doing my job." "You are doing it exceptionally well," Chen countered. "Administration wants to know if you would consider taking on a teaching role. Formal lectures for residents on trauma decision-making and ethical triage." Kate considered this. A month ago, she would have refused immediately. Too visible, too exposed, too much risk of having to explain her past. But now, with her story public, with her credentials restored, with her confidence slowly rebuilding, it felt less like danger and more like opportunity. "I will think about it," she said. That evening, Kate returned to her apartment and continued the journaling practice she had started after the crisis with Webb. Tonight, she wrote about the construction worker whose life she had saved, about the residents she was teaching, about the slow process of becoming whole again. And then she wrote another letter to Ryan Porter. Not the angry, guilty letters from years past. A different kind of letter. She told him that his death still hurt, that she still wished she could have saved him, but that she was learning to honor his memory by living well instead of drowning in guilt. By using her skills to save others. By teaching young doctors how to make impossible choices with grace and humanity. She told him about Marcus Webb, about the treatment he was finally receiving, about how they were both trying to heal from the same wound, about how complicated grief was and how long it took to transform. She told him that 87 Marines came home from Colonel Reynolds's deployments, that 117 people were safer because Maria Santos became a detective, that Michael Chen's 4 children existed, that Bobby Morrison helped terminal patients die with dignity. She told him that his death, however tragic, had not been meaningless, that it occurred in the context of a decision that saved multitudes, that remembering him meant honoring all of it, the loss and the survival, both. Kate finished the letter and set down her pen. Outside her window, San Diego glittered under clear night sky. Somewhere in this city, Marcus Webb was sleeping in his VA facility, perhaps dreaming of deserts, or perhaps finally finding peace. Somewhere Colonel Reynolds was home with his family arm functional career continuing. Somewhere Dr. Chen was reviewing tomorrow's surgical schedule. And here, in this small apartment, Catherine Hayes was learning to forgive herself. The work was not finished. Healing never was. But she was finally moving in the right direction. Not running from the past, but walking toward a future built on its foundation. Her phone buzzed. A text from Dr. Torres. "Thank you for today. Watching you work is like watching someone who has made peace with difficulty. I want to learn that." Kate smiled and typed back, "It is not about making peace with difficulty. It is about learning to function alongside it. See you tomorrow." She put down her phone and looked at her hands, the scars from burns sustained decades ago, the steady fingers that had saved lives today and would save more tomorrow, the evidence of who she had been and who she was becoming. These were a surgeon's hands, a soldier's hands, a teacher's hands. They were her hands, and tomorrow they would do good work again. Kate turned off the light and slept. And if she dreamed of the desert, she also dreamed of operating rooms, of patients saved, of residents taught, of a life built from trauma into something that mattered. The ghost was gone. Dr. Catherine Hayes remained, and the work continued. 6 months after the crisis at Mercy General Hospital, Kate Hayes stood in operating room 3 at 4 a.m, scrubbed and ready for the kind of surgery that separated competent surgeons from exceptional ones. Mass casualty incident. Multi-vehicle pileup on Interstate 5. 16 critical patients distributed across 3 hospitals. Mercy General received 5. The most severe was already on Kate's table. Female mid-30s compressed between 2 vehicles for 40 minutes before extraction. Crush injuries to both legs. Compartment syndrome developing bilaterally. Possible pelvic fracture. Blood pressure unstable. The kind of patient who could die on the table despite everyone's best efforts, or walk out of the hospital 6 months later to resume a normal life. The outcome would depend entirely on the next 4 hours. Dr. Chen stood across from Kate as first assist. Dr. Torres had graduated to second assist, her skills sharpened by months of watching Kate work. 2 surgical residents observed from the gallery. The anesthesiologist, a veteran named Dr. Richard Park, monitored vitals with the focused attention this case required. "Talk me through your thinking," Dr. Chen said. Not challenging. Teaching. Helping Kate demonstrate the decision-making process for the residents watching. Kate studied the patient's legs. Both massively swollen skin tight and discolored. Left leg worse than right. Fractures visible on imaging. Vascular flow compromised but not absent. Bilateral compartment syndrome confirmed, Kate said clearly. Left leg is priority. More severe swelling, longer extrication time, higher compartment pressures. We release left first, assess response, then address right. If we try to do both simultaneously, we lose focus and potentially miss complications. "What about the pelvic fracture?" Dr. Torres asked. "Stable for now," Kate replied. "Orthopedics will handle definitive repair after we ensure limb viability. Our job is to restore circulation and prevent rhabdomyolysis from causing renal failure. We save function first, then address structure." She positioned her hands over the left leg, mentally mapping the fascial compartments she would need to release. Time is critical, but precision is more critical. Kate continued, "If we rush, we cause additional damage. If we wait, we lose the limb. So we work with controlled urgency. Fast enough to matter, careful enough to succeed." She made the first incision. For the next 3 hours, Kate worked with the focused intensity that had become her signature. She released compartments methodically, monitored pressure responses, adjusted technique as the patient's condition evolved. When unexpected bleeding occurred from a small vessel damaged during the crush injury, she controlled it without panic. When the right leg's compartment pressures began spiking faster than anticipated, she delegated Dr. Chen to begin release there while she finished the left. The surgery became a carefully choreographed dance. 2 surgeons working in parallel, communicating constantly, responding to a situation that changed minute by minute. The residents watching learned more in those 3 hours than they would from a month of textbooks. By the time Kate stepped back and assessed the final results, both legs showed restored circulation. The patient's vital signs had stabilized. The anesthesiologist gave a thumbs up. Renal function was holding. They had won. In the scrub room afterward, Dr. Chen peeled off his gloves and looked at Kate with undisguised respect. "That was surgical artistry," he said. "I have been operating for 20 years, and I have never seen anyone manage a bilateral compartment release under those conditions with that level of precision." Kate washed her hands methodically. That was training and experience, nothing more. That was exactly what those residents needed to see Chen countered. Decision-making under pressure, adaptive thinking, the ability to make hard calls without freezing. You are teaching them how to be surgeons, not just how to operate. Kate dried her hands and looked at her reflection in the mirror above the sink. 6 months ago, she could barely meet her own eyes. Now she saw someone who had stopped running. Someone who had made peace not with her past, but with her ability to carry it. "How many surgeries is that now?" Chen asked. 47, Kate replied. 47 cases since I came back. And she paused, doing math that still amazed her. 47 patients who kept their limbs, or their lives, or both, because I chose to step out of the shadows. 47 victories, Chen said. That is what you should focus on, not the one you could not save 23 years ago. Kate smiled slightly. I am working on it. The support group Kate had started now met twice weekly instead of once. Attendance had grown beyond Mercy General to include medical professionals from across San Diego. 30 to 40 people gathered each Tuesday and Thursday evening to talk about the cases that haunted them, the decisions that kept them awake, the weight of responsibility that came with holding lives in your hands. Kate facilitated with the same precision she brought to surgery. She created space for honesty. She validated pain. She helped doctors and nurses understand that moral injury was real, that carrying guilt was normal, and that seeking support was strength rather than weakness. A pediatric oncologist talked about the child she could not save despite months of aggressive treatment. An emergency physician described the impossible triage decisions during a mass shooting. A labor and delivery nurse spoke about the mothers who did not survive childbirth despite perfect protocol. Kate listened to all of them and shared pieces of her own story when it served their healing. She talked about Al-Jura selectively, carefully offering it as evidence that you could survive impossible choices and build a life on the other side. She did not position herself as someone who had all the answers. She positioned herself as someone further along the path who could offer guidance to those just beginning their journey. The group became known throughout the regional medical community. Other hospitals asked Kate to help them establish similar programs. She trained facilitators, wrote protocols, shared resources. The work expanded beyond what she had initially envisioned, growing into a network of support that reached hundreds of medical professionals. Dr. Torres approached Kate after one particularly emotional session where a surgical resident had broken down crying over a patient death. You are changing how people think about medical trauma, Torres said, making it okay to admit, we are human. We have always been human, Kate replied. We just pretended we were not, because that is what medical culture demanded. I am just creating space for honesty. It matters, Torres insisted. I see the difference in our residents. They are learning that being a good doctor includes acknowledging when cases hurt you. That processing grief is part of the job, not a weakness. Kate watched the group dispersing people, exchanging contact information, making plans to support each other between meetings. This mattered as much as surgery. Maybe more, because preventing medical professional burnout and suicide meant preserving the people who saved lives. Her monthly visits to Marcus Webb continued. The changes in him were subtle but unmistakable. He was gaining weight, sleeping better, participating actively in therapy. The hollow rage that had defined him for decades was being slowly filled with something else. Not happiness, exactly, but purpose. In their 6th visit, Webb told Kate he had been accepted into the VA Peer Support Specialist training program. They want me to work with combat veterans struggling with PTSD and moral injury, he said. Help them navigate the system, connect them with resources, be someone who understands what they are going through. What did you tell them? Kate asked. I said yes, Webb replied. Then he looked at her with something that might have been hope. Do you think I can do this? After everything, Marcus. You understand combat trauma from the inside, Kate said. You have lived it, survived it. You know what helps and what does not. That makes you uniquely qualified to help others. What if I fail them? What if someone hurts themselves on my watch? Then you grieve and learn and keep trying, Kate said. That is what this work requires. Not perfection, just showing up consistently and caring deeply. Webb absorbed this. Is that what you do in your support group? Every week, Kate confirmed. I show up, I create space, I bear witness to pain I cannot fix but can help people carry. Some weeks, I feel like I make a difference. Some weeks, I wonder if I am doing any good at all. But I keep showing up because the alternative is abandoning people who need support. Webb nodded slowly. I want to be useful again. Want my life to mean something beyond revenge and rage. Then you are already healing, Kate said, because you are choosing purpose over pain. In their 9th visit, Webb asked about Ryan Porter's sister, Sarah. He had not spoken to her in years, not since his PTSD became too severe to maintain relationships. Do you think she would talk to me? Webb asked. Let me explain. Apologize. I think she might, Kate said carefully. But you should be prepared that she may not be ready, or may not forgive you. Amends are not about what we get back. They are about what we offer. I know, Webb said. I just want her to know that her brother mattered, that his death was not meaningless, that I have been trying to honor his memory by getting well instead of getting even. Kate helped Webb compose a letter, not asking for forgiveness, just acknowledging harm, expressing remorse, and explaining how he was working to transform his grief into service. They sent it with no expectations of response. 3 weeks later, Sarah Porter wrote back. Her letter was cautious, but not cruel. She thanked Webb for reaching out. She said she had known for years about his struggles and had prayed for his healing. She was glad he was getting help. She was not ready to see him in person yet. But maybe someday. Webb read the letter 3 times, then carefully folded it and put it in his pocket. She did not say she forgave me, he said. No, Kate agreed. But she said, maybe someday. That is more than you had yesterday. Webb smiled for the first time in Kate's presence. It was a small smile, fragile and uncertain, but real. I am trying, he said. Every day I get up and I try. That is all any of us can do, Kate replied. General Hargrove visited Mercy General quarterly to consult with Kate on military medical protocols. They met in conference rooms and reviewed triage guidelines, psychological support systems, integration of mental health services into combat medical care. But on his 4th visit, 8 months after the crisis, Hargrove brought news that changed everything. The Pentagon is implementing your recommendations, he said, spreading documents across the table. New protocols for combat triage that emphasize psychological support for medical personnel making difficult decisions. Mandatory peer debriefing after mass casualty events. Enhanced screening for moral injury in returning combat medics and surgeons. Kate studied the documents, her words, her experience, being transformed into policy that would affect thousands of military medical professionals. This will save careers, Hargrove continued. Maybe save lives. Medical personnel who understand they are not alone in carrying impossible choices are less likely to self-destruct. Kate felt something shift in her chest. Al-Jura had destroyed her, but maybe through these protocols it could also protect others from similar destruction. There is something else, Hargrove said. He pulled out a formal-looking document. The Secretary of Defense is issuing a commendation. for your service in Desert Storm and your contributions to military medical policy. There will be a ceremony at the Pentagon if you are willing to attend." Kate stared at the document. A commendation. For the worst day of her life. "I do not want honors, General. I want people to get the support they need." "You can have both," Hargrove said gently. "You can accept recognition for your service while also continuing the work that matters to you. They are not mutually exclusive." Kate thought about the young combat surgeon she had been. 29 years old, terrified, doing her best under impossible circumstances. Maybe she deserved to be honored, not for being perfect, but for trying. "I will think about it," she said. The call came at 2 in the morning, 3 weeks before the Pentagon ceremony. Dr. Chen's voice urgent but controlled. "Kate, we have a situation. Multiple trauma patients from a nightclub shooting. Triage is happening now. I need you here." Kate was dressed and driving within 5 minutes. Arrived at the hospital to find controlled chaos. 15 gunshot victims. 3 critical. 2 serious. 10 with minor injuries. And 1 decision that needed to be made immediately. 2 of the critical patients required emergency surgery. Both had similar injuries. Both had similar chances of survival. But the hospital only had 1 trauma OR available. The second OR was being used for an emergency C-section that could not be postponed. A third patient was also critical, but could potentially be stabilized with intensive medical management for the 90 minutes it would take to free up a second surgical suite. Someone had to choose. Which 2 patients got immediate surgery? Which one waited and hoped? The triage decision fell to the senior trauma attending on duty. That attending was Kate. She stood in the emergency department looking at 3 critical patients and felt the past 23 years collapse into this moment. This was Al-Jura again. This was impossible mathematics. This was playing God. Except it was not. Kate moved between the patients, quickly assessing injuries, reviewing vitals, calculating probabilities. The decision was not about which patient deserved to live. It was about which combination of interventions maximized total survival. Patient, a gunshot to chest. Hemothorax developing. Needed immediate surgery. Delay meant high probability of death. Patient B, gunshot to abdomen. Liver laceration. Also needed immediate surgery. Also high risk with delay. Patient C. Gunshot to pelvis. Significant bleeding, but vascular injury accessible for temporary control. Could potentially be managed medically for 90 minutes. Kate made the call. Patient A to OR1, she said clearly. Patient B to OR. 3 as soon as obstetrics finishes. Patient C gets interventional radiology for temporary hemorrhage control, then surgery when OR becomes available. Dr. Torres, who was triaging alongside her, hesitated. Patient C's bleeding is significant. Are you sure IR can control it? Kate met her eyes. I am not sure of anything. But A will die within 30 minutes without surgery. B will die within 45. C has a window. We use that window and pray it is enough. What if you are wrong? Torres asked. Then I am wrong, Kate said. And we do everything we can to save him anyway. But standing here debating options kills all 3. We move now. The teams dispersed. Patients were rushed to their designated locations. Kate scrubbed in for patient A, worked for 90 minutes to repair the chest trauma, succeeded. Patient B was in surgery, simultaneously also successful. Patient C held on through interventional radiology, got to surgery when the OR freed up, survived. All 3 lived. In the aftermath, Dr. Torres found Kate in the surgeon's lounge. How did you know? Torres asked. How did you make that call so fast? I did not know, Kate replied. I calculated probabilities and made the best choice I could with the information available. That is all triage ever is. But what if patient C had died? What if the IR could not control the bleeding? Kate looked at the young resident with compassion. Then I would have grieved, and questioned my decision, and carried that weight. But I would not have been wrong. I would have been a doctor in an impossible situation, doing my best. Just like I was at Al Jura. Torres absorbed this. So you never stop second-guessing? No, Kate said. But you learn to function alongside the doubt. You learn that doing nothing is also a choice, and usually the worst one. You learn that making hard calls is part of the job, and the only way through is through. How do you live with that? Kate smiled slightly. Community, support, therapy, and the knowledge that every patient you save is evidence that you are doing more good than harm. It does not erase the losses, but it balances them. The Pentagon ceremony happened on a cold November morning. Kate wore her dress uniform, the one that had been in storage for 23 years. It still fit, though it felt foreign after decades of civilian clothes. General Hargrove escorted her through the building past officers and officials who recognized her name, if not her face. The ceremony was small private, attended by military medical personnel who understood the significance of what was being honored. The Secretary of Defense presented the commendation personally. He spoke about combat medical service, about impossible decisions made under fire, about the long shadow of moral injury and the courage required to transform trauma into policy that protected others. Kate stood at attention and accepted the award with the same discipline she had brought to surgery and triage. When they asked if she wanted to say anything, she kept it brief. I did my job, she said. Under difficult circumstances, yes. But my job, nonetheless. If my experience can help others navigate similar challenges with better support, then perhaps the hardest day of my life can serve a purpose beyond my own pain. That is all I have ever wanted. The audience, filled with combat veterans and medical professionals, understood. They applauded not because she was a hero, but because she was one of them. Someone who carried weight. Someone who kept showing up despite the cost. After the ceremony, Kate found herself surrounded by young military medical officers, asking questions about triage, about decision-making, about how to survive the psychological toll of combat medicine. She answered each question honestly, did not sugarcoat the difficulty, did not pretend there were easy answers, but offered hope that functionality was possible even when healing was incomplete. A young captain, barely older than Kate had been at Al Jura, asked the question they all wanted answered. How do you forgive yourself when you make a choice and someone dies? Kate thought about Ryan Porter, about the 23 years she spent running, about Marcus Webb and Colonel Reynolds and all the others shaped by one day in the desert. You probably do not, she said, finally. Not completely, but you learn to carry the guilt without letting it define every choice you make afterward. You learn that one bad outcome does not negate a career of good ones, and you learn to trust that you did your best with the information and resources you had. She paused, choosing her next words carefully. The people we lose stay with us. That is appropriate. That is human. But we dishonor them if we let their deaths paralyze us. The best way to remember them is to keep showing up, keep trying, keep saving the ones we can save. That is how we transform tragedy into purpose. The young captain nodded, blinking back tears. Thank you, ma'am. Kate returned to San Diego that evening and went directly to the hospital. She had surgery scheduled the next morning and preferred to sleep in the on-call room rather than risk being late. But first, she made one stop. Operating room 3. Empty now. Quiet. The space where everything had changed 6 months ago, when Colonel Reynolds saluted her and the ghost she had been pretending to be shattered. Kate stood in the center of the room and looked at her hands. The scars from burns sustained in 1991. The steady fingers that had saved 47 patients in the last 6 months. The evidence of who she had been and who she had become. These were a surgeon's hands, a soldier's hands, a teacher's hands. They had made impossible choices. They had saved lives and lost lives. They carried history and purpose intertwined. Tomorrow, they would operate again. Next week, they would teach residents. Next month, they would help craft better military medical protocols. The work was endless, but it was good work, meaningful work, work that honored the living and the dead both. Kate heard footsteps. Dr. Chen appeared in the doorway. "Thought I might find you here," he said. "Cannot sleep before big cases either." "Old habit," Kate replied. Chen joined her in the empty OR. They stood in comfortable silence, two surgeons preparing mentally for tomorrow's challenges. "I got the official word today," Chen said. "You are being promoted to surgical director, effective next month." Kate looked at him in surprise. "I thought you held that position." "I am moving to chief of surgery," Chen replied. "And I recommended you as my replacement." The board agreed unanimously. "I have only been back 6 months. You have 23 years of experience plus 6 months of proving you are the best trauma surgeon this hospital has ever had," Chen countered. "The job is yours, if you want it." Kate thought about responsibility, about visibility, about stepping fully into the light instead of lingering in shadows. "I want it," she said. "Good," Chen replied, "because I need someone I trust in that role. Someone who understands that medicine is not just about technical skill. It is about making hard decisions with humanity intact." They left the OR together, walking through quiet hospital corridors. At the elevator, Chen paused. "You have changed this place," he said. "Not just the trauma department, the whole culture. People talk about moral injury now, about supporting each other, about being human instead of pretending to be invincible. That is your legacy." "I just created space for honesty," Kate replied. "That is exactly what was needed," Chen said. Kate returned to her apartment at midnight. Tomorrow would bring new challenges, new patients, new impossible decisions. But tonight she had one more letter to write. She opened her journal and wrote to Ryan Porter for what she knew would be the last time. She told him that she had finally accepted that his death was not her fault. That war killed him, not her triage decision. That she had done everything humanly possible, and it had not been enough. And that was the tragic reality of combat, not a personal failure. She told him that Marcus Webb was healing, that Colonel Reynolds was thriving, that 87 Marines came home because she saved Reynolds, that countless veterans would receive better support because her trauma had been transformed into policy. She told him that she was finally living instead of just surviving, that she was using her skills to save lives, that she was teaching others how to navigate impossible choices, that she was building something meaningful from the rubble of the worst day of her life. She told him she would always remember him, always carry the weight of his death, but that she was choosing to carry it as motivation rather than punishment, as a reminder to do good work, to show up consistently, to help others bear their own impossible weights. She finished the letter and closed the journal. Outside her window, San Diego slept under clear night sky. Somewhere, Marcus Webb was dreaming in his VA facility. Somewhere, Colonel Reynolds was home with his family. Somewhere, Dr. Chen was reviewing surgical notes. And here, in this small apartment, Catherine Hayes was finally at peace. Not healed, not absolved, not free of guilt or grief or the memories that would always carry weight, but functional, purposeful, moving forward instead of running in circles. The ghost was gone. Dr. Catherine Hayes remained, and tomorrow morning her hands would save another life. She looked one more time at her reflection in the dark window, saw not the broken combat surgeon who had hidden for 23 years, saw instead the woman who had chosen to step back into the light, who had refused to let trauma define her entire existence. Who had transformed the worst day of her life into a foundation for helping thousands of others? Major Catherine Hayes had died in 1992. Kate Hayes, the nurse, had existed in shadows. But Dr. Catherine Hayes, trauma surgeon, teacher, advocate for medical professionals carrying impossible weights, was fully alive. The salute that Colonel Reynolds gave her in Operating Room 3 had not just been recognition of who she had been. It had been an invitation to remember who she still could be. A healer, a leader, a person who makes hard calls with wisdom and compassion and refuses to let failure crush her spirit. Kate had finally accepted that salute, and in accepting it, she had given herself permission to stop hiding and start living. The work would continue. The weight would remain. But she would carry it alongside colleagues who understood, patients who needed her skills, veterans who benefited from her advocacy, and the memory of Ryan Porter not as guilt but as motivation to do good work every day. Kate turned off the light and slept deeply. And when she dreamed, she did not dream of the desert. She dreamed of an operating room where her hands moved with certainty, where patients survived, where residents learned, where impossible choices were made with courage instead of fear. The ghosts were finally quiet. The surgeon had returned, and the salute had been answered.